Hi, my name is Jessica Abilo, and for our population-based public health practice for RN's class, I will be discussing substance use in Minneapolis. The use of substances like opioids, alcohol, and other illicit drugs is a critical public health crisis in Minneapolis. My goal with this project is to examine the scope of the problem, analyze protective and risk factors, and propose a community-level public health intervention that can help reduce harm and improve outcomes. The CDC defines substance use as the use of various substances that include alcohol, tobacco, and illicit drugs, which can lead to dependence or other harmful effects. When substance use leads to health problems, social disruptions, or overdose, it's considered a substance use disorder per Cleveland Clinic. Substance misuse and substance use disorders contribute significantly to chronic disease, injury, death, and more, as noted on the Minnesota Department of Health website. Later on, we're going to discuss the economic impact of substance use. This costs anywhere from millions to billions annually across the nation. We're going to discuss incidence and prevalence here. According to the city of Minneapolis, the highest risk of fatal overdoses is among adults aged 25 to 64. In 2024, 88% of fatal overdoses occurred in this age range. There are significant racial disparities as well. The death rates for Black residents were about 3 times higher than white residents, and for American Indians, about 8 times higher. Next, we're going to be looking at national, state, and local data. Like I stated, the economic impact is immense. In the U.S., alcohol misuse costs $249 billion annually, while illicit drug use costs about $193 billion annually. This is due to healthcare costs, criminal justice, and lost productivity per the CDC. This is why it is essential to reduce the incidence and prevalence of substance use while increasing access to treatment and mental health services. On a national level, substance use continues to be a critical issue, which places a heavy burden on health, productivity, and social systems. Looking at the facts here, in Minneapolis, opioid deaths have decreased by 26% between the 2023 and 2024, while the rates for Minnesota overdoses decreased 8% from 2022 to 2023. Despite this progress, non-fatal overdoses remain high. In Minneapolis, substance use is an urgent concern. One community volunteer I interviewed stated, "Substance use, especially opioid and fentanyl use, is one of the most urgent public health issues we are facing in this city. There are overdoses weekly, sometimes daily, depending on the neighborhood. This places a huge strain on community resources, such as EMS and hospitals." There are various factors behind data differences we see. These are influenced by age, racial disparities, and socioeconomic inequities. As noted, there are higher rates of overdoses in Black and American Indian communities that reflect overall healthcare inequities across the board. Even with the expansion of naloxone availability, we may see reduced deaths, but the incidence of misuse still remains about the same. To better understand the community impact, I spoke with 2 key informants who work directly with people affected by substance use. GP is a volunteer at an outreach clinic in North Minneapolis, and NF is a volunteer at a nonprofit in Northeast Minneapolis. Both shared their experiences working for their nonprofits. They both emphasize the importance of community-based services and harm reduction, and noted barriers such as housing instability and co-occurring mental health disorders. We can look at this issue through the lens of the epidemiologic triangle. The agents are substances like opioids, meth, alcohol, with increased potency and fentanyl contamination, therefore elevating the risk. The host includes high-risk individuals who are often facing poverty, chronic pain, trauma, mental health issues, and more. And the environment includes systemic factors like the availability of synthetic opioids, economic distress, racial inequities, and gaps in healthcare access per the city of Minneapolis. On November 29th of this year, I conducted a windshield survey in North and Northeast Minneapolis. On Central Avenue in Northeast Minneapolis, there is busy street life, a wide variety of ethnic businesses, restaurants, public transit stops, and moderate noise. The natural environment includes small trees, patches of grass, some city wildlife like birds and squirrels. In North Minneapolis, along Lowry and Penn, there are older, slightly dilapidated homes, lighter traffic, but more sirens, fewer green spaces, and visible community challenges like poverty and limited fresh food options. In this next slide, we're taking a look at some places that I had driven by for my windshield survey. The first picture here on the left-hand side is Lowry Avenue on Penn. And it is showing a liquor store and a bus stop, some traffic. During the summertime, there are quite a few people that hang out in this parking lot. The middle picture here is one of the fire stations in Minneapolis. And this little vending machine actually houses free naloxone. They also have signs up that say if they would like some help with drug use and syringe exchanges, they can come into the fire department. This picture on the right-hand side is Central and Lowry. This street is full of Ecuadorian, Colombian, Somalian restaurants. And then they also have various businesses such as grocery stores, bodegas, banks, breweries, and the like. Protective factors include a strong community presence, local businesses, and outreach programs. According to Schoon and Porta, risk factors include poverty, housing instability, and limited access to care. During my interview with NF, she stated that Minneapolis has a variety of community resources, which include recovery programs, safe syringe and naloxone distribution, mobile medical services, and harm reduction efforts. Collaboration between organizations helps to fill service gaps, and public awareness may reduce the stigma behind substance use, which therefore supports pathways to treatment. There are risk factors we must consider, such as racial and ethnic disparities, age vulnerability, limited treatment access, and the availability of potent synthetic opioids. This was found on the City of Minneapolis' website and the U.S. Department of Health Services website. Healthy People 2030 sets goals to reduce substance misuse and overdose deaths, and these goals can guide local interventions by increasing treatment access and reducing mortality. This was found on the Office of Disease Prevention and Health Promotion website. The objective, for example, would be to reduce opioid-related deaths by 25% over 3 years. For a public health intervention, I propose a citywide mobile outreach program. This would provide education, harm reduction, overdose prevention, and minor treatment services directly in high-risk neighborhoods such as Northeast and North Minneapolis. The mobile units would include a public health nurse, counselor, and peer support specialist. We would offer clean syringes or syringe exchanges, naloxone, drug test kits, and treatment referrals. GP, who I interviewed, emphasized that meeting people where they are works better than expecting them to come into clinics, and peer-led models are more effective because clients respond well to those with shared lived experiences. As far as implementation, we would need city and state funding, coordination with local organizations, hospitals, shelters, trained personnel, as well as outreach through trusted community channels. We could collaborate with organizations like the Minnesota Department of Health. And there are barriers such as stigma, mistrust, workforce shortages, and regulatory challenges that must be considered, NF stated. As for the evaluation, we would focus on key health indicators: opioid-involved overdose death rates, non-fatal overdoses that were treated in local hospitals, and the number of individuals receiving substance use disorder treatment. Baseline data would be collected before implementation and tracked over time to measure the true impact. We could compare data from baseline to year 2 and year 3. Positive outcomes would include decreased deaths and increased treatment use. To conclude, substance use is obviously a serious public health issue in Minneapolis that disproportionately affects certain age groups and ethnic communities. Recent declines in fatal overdoses are encouraging, but more work is still needed. A community-level outreach program would reduce harm, increase access to care, provide education, and bridge structural barriers. With implementation and evaluation, this program could improve health outcomes and advance equity across Minneapolis. For my advocacy project, the focus would be to improve access to harm reduction and treatment, and note that substance use is identified as a primary public health concern in Minneapolis. The audience would be local policymakers and the Minneapolis Department of Health. Influences from policymakers and the Minneapolis Department of Health help to resource allocation and public health programming. Actions requested would be to expand mobile outreach units citywide, increase harm reduction funding, and increase support from community organizations when opposition may be likely due to the stigma behind substance use disorder. I have chosen to create a policy brief due to the clarity and impact. Response for presentation outcomes is dependent on awareness, priorities, and resource capacity available to our city. Key takeaways include that substance use is multifaceted and inequitable. Harm reduction helps save lives. Community-based strategies are essential. We must go reach the people that need this the most where they are. And mobile outreach helps remove barriers and improves access. And next are my references. Thank you.